How to properly treat your jaw pain or temporomandibular disorder, or we call it TMD, by Dr. Richard Zhao. What is a TMD? TMD have three main symptoms. Number one is you have a one side or both side jaw pain. When you eat, when you talk, or even when you rest, sleep, it's painful. Secondly, people cannot open the jaw fully. Normally, we can open the jaw widely, even with your three finger on a line, and you can put these three fingers in the mouth. So if somebody cannot open the jaw widely as your three fingers, or sometimes only one finger or two fingers or less, that will be one symptom. The third symptom, when you talk or when you open the jaw, make crack sound on your other side, and sometimes make it painful as well. So these three symptoms together can affect your eating, talking, and even your sleep. First, let's look at the anatomy of the jaw.
TMJ, or jaw joint, is a synovial joint that allows the complex movements necessary for life. It is the joint between condylar head of the mandible and the mandibular fossa of the temporal bone. TMJ is related to different muscles that have the function to move and protect the joint itself. The muscles that function to close the jaw are masseter, lateral or external pterygoid. The muscles that open the jaw are medial or internal pterygoid, gynohyoideus, mylohyoideus, digasterag.
The nerves control the jaw movement and the sensation are trigeminal nerves. The second cervical nerves also go to the jaw and the ear area. Second, the cause of TMD. There are several causes for TMD. The first thing is teeth grinding, wear and tear of the joint, blow to the head or face, stress, uneven bite, but they are all less important. Most important thing is pinched nerves on the neck is cervical 2. That means the second cervical nerves pinched. Third, the treatment for TMD. Number one, how to help yourself. Eat soft food. Take paracetamol or ibuprofen. Hold an ice pack or heat pack to your jaw. Massage the painful jaw muscles. Trying to find the way to relax. Number two, if you go to see your GP, he or she may suggest you take strong painkillers. Find some relaxation techniques, or find a way to improve your sleep. Also, they might suggest you to see a dentist, to see a psychologist, or to see a physiotherapist. Number three, the most important thing is to use Dr. Zhao tuner to open the C2 nerves. From this X-ray, we can see patient the C1 and C2 vertebra is too close, and when they closed, they will press on the nerves, and also in Chinese medicine we said the dual meridian will be blocked on do 15 points. So the important thing is we try to open this point. From this structure, we can see when patient have the force going downwards to press this vertebra downwards, then the C2 will be pressed. So use Dr. Zhou Tuina technique, which is put your thumb on C1 vertebral process, and then slowly move up this vertebral for a few minutes until you feel the C1 is moved and all the nerves being released. Patient can easily open the jaw without pain. And we can repeat this several treatments once a week or several days treatment. So this will greatly help the TMD. Okay, thank you. If you want more information, you can contact me, and also you can visit my website. Okay, thank you. And last, let's see how a severe TMD patient has been cured by Dr. Zhou. Okay, Wendy, you came last week.
Yes.
Yeah, and you saw my sign on the car park.
Yes.
And
yes,
then you
Thank
immediately
goodness I found
recognized
you.
me.
Yes.
Yeah, so quite 7 years ago.
Yes,
yeah.
I think it was about 7 years ago.
Yeah, I treated your husband.
Yes.
Carl. Yeah.
Carl,
Can
yes.
you tell me about your husband?
Yes,
story?
you were amazing. You were fantastic for him because he'd gone through all the medical routes, and they told him he couldn't open his jaw more than a finger.
More than
width.
one finger.
Yeah.
Couldn't open the jaw.
Yeah, couldn't open, and he'd been backwards and forwards to the doctors, and eventually the specialist told him that they would break the jaw.
Yeah.
But it wouldn't fix it.
Yeah, just
So
open a
he
little
didn't.
bit.
Yeah, he didn't want to do that.
Yeah.
And then my sister-in-law, Sarah came and had been coming to you for lots of different eczema and different things which you were able to fix for her, and very quickly.
Yeah, a few sessions. Yeah.
It was very painful for him actually,
treated
but he's a big
nerves.
man and he could handle the pain.
Yeah.
And you were amazingly strong with him, I think, because other people couldn't.
Yeah.
And within
the jaw opened.
Yeah,
wow.
within the first session the jaw opened,
Yeah.
and then within a few sessions after that, and he's never had a problem.
Oh, that's great.
And before that, his jaw always clicked when
Clicking.
he was eating.
Yeah.
But it doesn't do that anymore.
Oh, that's
so
great. So
amazing.
I forgot.
He was so grateful.
Okay.
He was so
that's
grateful
very
to you.
good. I'm
He's still
very
grateful
pleased.
to you.
Yeah, I'm very pleased to do that.
Yes,
and also this time you had 2 hip pain,
2 hip pains,
and 1 shoulder pain.
Yes.
And after I give you around 1 session or 2 sessions.
Yes.
And then how do you feel?
Much looser.
Yeah,
much looser.
And your
my
could,
arm, which has been. Oh, this is fantastic.
Yeah,
this is really
and
great.
also your hips
I can
better.
even go back now. Yeah.
Yeah.
The hips much freer. It
Freer.
feels so much looser.
Yeah.
Yes,
I think by a few more sessions, we
Yes.
do more hip.
Yes.
And also the shoulder.
Yes.
So I try to release all the.
I can definitely feel the pain
Release
in
all
the neck.
the nerves.
Yes.
And because nerves give your joint energy and also sensation,
yes.
which is if they are tight then painful.
Yes.
If the nerves.
And I think I get tense.
Yeah, tense.
And that doesn't help.
And
I think.
we try to open the neck and the back to help your shoulder and
it
jaw.
definitely feels released. It feels looser.
Yeah, I think you will be cured. No problem. Yeah, okay.
I'm so excited you
Okay,
can help me.
thank you. All the best. All right.
Thank
okay.
you very much.
All the
Dr.
best to
Zhao.
your family.
Yeah,
Okay.
Thank you.
Okay.